Lottery.
Back now on Triad today, I'm so honored to have this next guest with us. Jay Pollard, Director, if we can see our very distinguished physician, Dr. John Tipton from the Piedmont Center Family and Sports Medicine at Cornerstone Healthcare Practice. I said I'm very honored to have you here because especially with this topic that we're going to tackle, so thanks for being here.
Thank you.
Talking about concussions. Do you see a lot of concussions in your practice, and do you see a lot of in youth, or is it certain age, or whatever? Tell me about that.
I do, actually. I cover high school sports and also college sports, and it's becoming more prevalent. And I'm seeing patients that come in that need to be evaluated and treated for that. Are people
just, I mean, we didn't rehearse any of this, but are you seeing them because they weren't careful, they weren't wearing, I mean, I can't imagine a football player not wearing a helmet, or can you get a concussion even wearing a helmet? Or, I mean, why are you seeing so many, do you think?
You know, that's a good question. I don't know that answer, but it's becoming more prevalent for some reason. And it's not necessarily that the athletes are careless or the person's careless. It's just happening more.
The impact is such.
Exactly.
You see it even on pro sports like that. What is a? Well, I know what I was remiss if I don't ask this. What is a concussion? Can you give me sort of a? Don't be too technical because I don't understand these things, but just sort of simplify it.
Sure.
What is a concussion?
Well, it's a form of brain injury that's you usually can't see it, and it's a result of either a direct or indirect blow to the head. And what I mean by indirect is that a force or a blow can be anywhere in your body, and the force of that blow, for example, anywhere in your body on the chest, the force of that blow can be transmitted to the head.
I did not know that.
So, yeah.
Oh, my gosh.
So.
Well, now, that's interesting. What are there signs and symptoms you can look for? If I understand if you get hit hard in the head, you might want to go to the doctor, but if you've been hit in the chest, are there signs and symptoms you can look for that might say, hey, you got a concussion?
Yes. As far as the signs go, as an observer, you could see that the athlete or person that had the head injury could appear dazed or confused. They could be forgetful. They can sometimes have a loss of consciousness. They answer slowly, or they have an abrupt change in their behavior.
So this can happen quickly.
Right.
How can you prevent a concussion, or is that a stupid question?
No, it's not. Actually, it's a very good question. You know, every sport is different. So first and foremost is educate the athlete about the rules of the game and have good sportsmanship. That's the main thing. Secondly is wear protective equipment, and wear that at all times, even practices and at game time, and make sure they're fitted properly.
Yeah, there is a lot of bad sport. We didn't have you on to talk about bad sportsmanship, but I think that as an adjunct to this conversation, there is. I mean, I've seen these clips lately, and you have too, of hockey games and other things, even girls' college soccer games where people are just violent with each other, and that's just got to stop.
Yeah.
We're already at risk enough anyway. How do you treat a concussion? If somebody says, you know, Doc, my child was playing yesterday, he got a concussion. What do you do for him?
Well, first of all, what I tell the parents is if you see somebody that has a concussion or thinks that they have a concussion, seek medical attention right away and have them be evaluated by a professional that is familiar with concussions and how to treat them. Secondly is take them out of the game. Avoid play and all activities. It's a brain injury. You want to rest their body and their mind, so that means no school, no watching TV, no reading, no listening to music, that sort.
If you do everything you said, and you do it, and you follow the doctor's orders, I mean, what are the outcomes if somebody has an honest-to-goodness concussion? I mean, do they heal up fast?
Usually within a week. So the clinical and cognitive symptoms usually heal in a sequential course, mostly within a week. But there's a small percentage that has prolonged post-concussive symptoms, like we've mentioned.
And you don't want to
before.
go out and play football or tennis or something right away. Even if you start to heal up, you want to wait.
Right. You want to make sure those symptoms are completely healed, no medication needed, and then go to a graded return to play.
All right. I want to put up some information and sort of a shout-out to some good folks to help make the segment possible. High Point Regional Health System, of course. True Alliant Federal Credit Union, Mark Schaefer and his good folks at True Alliant Federal Credit Union helping to make these healthcare segments possible. But also I want to identify that this is a Cornerstone healthcare practice, and you can go to www.cornerstonehealth.com. Now, your actual practice at the Piedmont Center Family and Sports Medicine, where's that located?
North High Point, near Jamestown, and Wendover and Palladium.
All right, can they find you from that website then? I think so. I think you can go there. All right, we'll click through on that. Doc, will you come back sometime?
Absolutely.
Thank you so much for all you do.
Thank you. You're welcome.
All right, we'll be right back after this.